Wel, bore da, a chroeso cynnes I bob un ohonoch chi I gyfarfod heddiw bwrdd iechyd addysgu Powys. Ac fel y gwelwch chi, mae'r cyfarfod yma yn cael ei ffrydio yn fyw trwy ein gwefan, ac yn ôl ein harfer, mi fydd na recordiad o'r cyfarfod ar gael i'w gwylio yn dilyn y digwyddiad heddiw. It's a pleasure to welcome each and every one of you to this meeting of the board of Powys Teaching Health Board, and as always we are live streaming the meeting via our website, and also as we always do, there will be a recording of this meeting available on our website for people to view after today's event. Cael cwpr ydw I a fi ydi cadeirydd y bwrdd. Ac yn y man, fe welwch chi ar y sgrin enwau a manylion cydweithwyr y bwrdd, sef aelodau annibynnol ynghyd ag aelodau gweithredol fydd yn bresennol yn ein cyfarfod heddiw. Hefyd, fe welwch chi ar y sgrin enwau cydweithwyr sy'n methu bod gyda ni heddiw a dyn ni wedi derbyn eu hymddiheuriadau am absenoldeb. So on the screen now, you can see details of board colleagues, both independent members and executive members, and together we make up the unitary board, the governing body of our organisation. You can also see on the screen names of those colleagues that can't be with us today and whose apologies for absence we have accepted. Fel wedais I, corff llywodraethol y bwrdd iechyd ydy'r bwrdd, ac ein pwrpas ni ydy llywodraethu, ynde? Ond beth mae hynny yn golygu? Wel, yn bennaf, mae gennym ni 4 prif gyfrifoldeb. Yn gyntaf, dyn ni yma I osod cyfeiriad strategol ar gyfer y sefydliad. Yn ail, dyn ni yma I bennu hefyd ar chwaith risg wrth I ni gyflawni yr amcanion strategol hynny. Yn drydydd, dyn ni yma I fonitro ac I graffu ar perfformiad ein sefydliad wrth I ni gyflawni yr amcanion strategol. Yn bedwerydd ac yn holl bwysig, dyn ni yma I fodelu ac I osod diwylliant a thôn y sefydliad. Hynny yw, diwylliant sydd yn seiliedig ar ein gwerthoedd ni. Ac yn olaf, ond yn sicr nid yn lleiaf, dyn ni yma I sefydlu ac I gynnal safonau uchel o ran llywodraethiant corfforiaethol. So as a board, we are the governing body of our organisation. Our purpose is to govern, clearly. But what does that mean? Well, essentially, we have 5 main responsibilities. First, we're here to set the strategic direction for our organisation. Second, we're here to set the risk appetite in relation to the delivery against those strategic aims. Third, we are here to monitor and to scrutiny delivery and performance against those same strategic aims. Very importantly, fourthly, we're also here to model and to shape the culture and the tone of our organisation based on our values. And lastly, but certainly not least, we're here to establish and maintain high standards of corporate governance. Dyn ni'n cwrdd heddiw yn unol â rheoliadau y gwasanaeth iechyd yng Nghymru, falle bod hi'n bwysig just I esbonio taw nid cyfarfod cyhoeddus ydy hwn bod ni yn cwrdd yn gyhoeddus. It's probably helpful to just draw a distinction in that although today we meet in public, our meetings are not public meetings, and so the only people that participate in our meetings are board members and invited participants. However, there is always a standing item on our agenda which invites questions from our public, our patients, and from our population. And certainly, if anyone would like ever to ask a question of us as a board, then information is on our website as to how you can submit your questions, and we certainly do welcome those. So, of late, for those that are familiar with our meetings, we have had some very substantial and meaty items on our agenda in our recent meetings. And of course, we have very important items on our agenda for this meeting, not least our financial position, our performance against those strategic aims, and so on, as I said earlier. However, it's probably the case that our meeting today contains more routine matters compared to more recent meetings. It's also the fact that almost all of our papers today have already undergone detailed scrutiny in one or other of our subcommittees. And so we will be receiving assurance from those committees and from the chairs of those committees following the scrutiny that has taken place in those subcommittee meetings. Also on our agenda, we operate a consent agenda, agenda cydsyniad, and you'll see this under section 4 of our agenda. And what that means is that there are certain items there that we have deemed to be non-controversial, non-contentious, and actually items that we can make decisions about en bloc and that don't need time for discussion or consideration today. However, the content of the consent agenda is always in the control of the board. And under section 2 of our agenda, I will give an opportunity to any board member to request that any item that is currently in section 4, the consent agenda, be removed and placed as a substantive item for discussion on the main agenda item, should any board member want to suggest that. So, and the final thing, perhaps just to mention, is that if anybody wants to follow the detail of our business today, our agenda and papers are published on our website. They are publicly available, and so please do access them there so that you can follow the detail of our discussions and conversations. Ond dyna i gyd gyda i o ran sylwadau cychwynnol. So, dyn ni'n symud rwan at ein hagenda ac at eitem 1.2 ar ein hagenda, sef datganiadau o fuddiannau. Without any further ado, we move to the agenda and initially to item 1.2, declarations of interest. Within our papers today, our register of member interests is publicly available, but I will invite any board member colleague either to mention any additional interest that isn't on our register, or indeed draw our attention to any connection between any agenda item today and a registered interest. Would anyone like to do that, please? Please indicate if you would. No, there are none. Therefore, we turn our attention to 1.3 and the board action log. And I'm going to invite our Director of Corporate Governance, Helen Bushell, just to introduce the current position of the action log. Thank you, Helen.
Diolch, Carl. Bore da. Good morning, everybody. So the action log is presented to the board today. There are 6 actions recommended for closure towards the bottom of the action log, with relevant updates provided, and very happy to take any questions or comments that you have on those. At the top of the log, then there are 2 items that are on track. These were previously reported and agreed by the board with the relevant timescales of November and September of this year, respectively. So no further updates to provide, but they remain on track to report at those board meetings. So happy to take any questions, Carl. Thank you.
Thank you. I can see that Mick would like to come in. Please do, Mick.
Can I just ask a question about Action 158, please, which relates to the cross-border functionality of the NHS app? So I can see that the action is recommended for closure. No objections to that. But on that basis, it's been transferred from PECS then to ARAC, and now it's been allocated to the Executive Committee. And the action suggests that this would come back through regular board reporting. But when I look at the update in the Exec Committee report in paragraph 1, in item 1.7, it's quite high level. And both ARAC and PECS were quite concerned about this issue. So could I just ask for a bit more detail, please, in terms of the current position? Given that the matter is now marked as closed on the board's action log, can you just give me assurance about how this matter, will come back to the board in terms of how it has been or has been resolved beyond that kind of, high-level reference in the Exec Committee summary?
Thank you, Mick. Helen.
Thank you.
Yeah.
Of course, thank you. Thanks, Mick. Thanks for the point. So I'll ask Claire Madsen to come in and add a little bit more detail in terms of the actual response, if that's okay. In terms of the way that we would track and govern this, so it will remain an escalated item to the board until the board determine that it's sufficient to de-escalate it. We'll report that through the committee chair's report. Hear your point and feedback, and we'll make sure that that's a little bit more updated and explicit in future terms. But it will also be in the summary report of escalated items, so we won't lose it in the detail of the report. We'll keep it in the summary report from the committee chairs later as well. But Claire, would you be happy just to add some further detail? Thank you.
Yeah, thank you, Chair, and thank you for the question. So there's ongoing work with the NHS app at the moment. We have escalated our concerns to Welsh Government. So we've had a meeting with the Deputy Director of Primary Care, who's the project manager, regarding the NHS app. The programme at the moment is on what they're calling a review and reset, waiting some new government priorities and a new way forward. So we're waiting on information regarding that. So we've asked for another meeting specifically with Powys Teaching Health Board. We have a date in July now to meet with them around this. We've made our issues really clear regarding the challenges we have in Powys, particularly with the cross-border challenge that we have. And more broadly on the cross-border, we're having conversations with Welsh Government and looking at how we can escalate ways of improving our cross-border data transfer and information exchange. So that's also an ongoing piece of work. And just for the board's information, there is an All Wales digital conference tomorrow, and we will be discussing issues like this, and particularly the future blueprint, digital blueprint for Wales is on the agenda for tomorrow. So that there's a lot of discussion going on nationally about the way forwards and how to solve some of these ongoing challenges.
Mick, do contribute again if you'd like to.
No, thanks, Chair. That's helpful. Thanks, Claire. And Helen, I'm reassured that there is a grip around this and we won't lose sight of it. So thank you.
Thank you. I'll just pause. Should anyone else have anything that they would like to say in response to the action log? It doesn't seem so. So thank you for that. So we go on to item 1.4 of our agenda, and again we use this point in our agenda as part of our way of bringing to life, if you like, the real experiences of our patients and our staff, that, if you like, makes real a lot of the information and a lot of the papers that come to us as a board and as committees. We do have a patient experience story today. I should explain that the patient experience story today deals with matters that some colleagues or some people may find upsetting, issues regarding heart attack and stroke and death, sudden death from road traffic accidents and so on. And so if you think that you're going to find it particularly upsetting to watch this video story, then please do feel free to leave the meeting and come back later. It is a video, and the video will last for around about 7 or 8 minutes. But I'm going to ask our Executive Director for Nursing Quality, Women and Family Health, Paul Hooton, if he'd kindly introduce the story to us. Thank you, Paul.
Hi, good morning all, and thank you, Carol, and thank you for that warning at the top of this story. Overall, this is a very positive story in terms of Jean, who you will see speaking in the video. Jean initially talks about her husband's journey through cardiac rehabilitation following a stroke and heart attack later in his life, and subsequently, when Dave passes away due to an accident that you will hear about in the story, Jean herself suffered some health issues later in her life, and again accessed the same cardiac rehabilitation service within Powys. And although there are elements of the story that may be hard to hear, Jean's overall journey is a very positive one from her perspective in terms of her interactions and the service she received from cardiac rehabilitation and other healthcare providers, both within Powys and also both in Australia and in the UK, as you will hear. So I'll stop now. I'll introduce Jean and let her tell her story. Thank you.
In 2014, my husband had a heart attack, and then the following year he had a massive stroke. Ended up for 13 weeks in Bronglides and Newtown stroke unit. Had excellent treatment, and thanks to the amazing support he had and encouragement from the physios, he actually made a very good recovery. He was then referred to the exercise referral scheme and met Kathy. Well, I can honestly say that meeting Kathy probably changed his life and my life. He gained so much motivation, encouragement. I used to go with him. I used to take him. I used to drop him off, and then I'd go for a swim, and then I'd pick him up an hour later, and he was always cheerful. And then over the next 9 years, he had a pretty checkered career health-wise, but he did survive another 9 years. He then, and this was very unfair and unfortunate considering he'd done so well, he then died just 2 years ago. We're just coming up to the anniversary, because he was knocked down in Tesco's car park. I turned my back and opened the door for him to get in, and heard a commotion behind me. When I turned round, this car had knocked him over and run his leg over. The ambulance was there in no time, and we went off to Shrewsbury Hospital. He struggled for 3 weeks, remaining very cheerful and positive, but the injury was too great for him to survive it, and they were going to do a hindquarter amputation of his leg. I knew that he wouldn't survive the operation, and I think he knew that. So we had a talk about it and said, "What do you want to do?" He said, "I'd like to go home." So we opted for end-of-life care, and we were going to go home the next day, and he was really happy about it. Said, "Well, you better go and get some sleep. We've got a busy day tomorrow if we're going home." And so I kissed him goodbye and said, "See you the first thing in the morning." And 3 hours later, the hospital rang to say that he'd died peacefully with a smile on his face. A year to the day from losing him, I planned a round the world trip. I had a week in Costa Rica. I then flew on to Australia to visit friends there, crossing the international date line on the Dave's anniversary, because it seemed very significant somehow do something like that. Then I spent a couple of weeks in Australia with friends. I'd always been fighting fit. I belonged to a walking group. I do an 8-mile walk twice a week. I go to yoga, Pilates. I swim once a week. We stopped in a parking lot, and I had been feeling a bit queasy, but I thought that was due to the fact that my friend was driving very erratically. But at this stage, I think I had begun to suspect it might be my heart, because I was surreptitiously taking my pulse, which was about 45. And I thought, oh dear, these two women who had spoken to previously, the first aiders, came over and said, are you okay? And I said, no, I'm not. I feel terrible. I think I'm having a heart attack. I happened to be sitting outside a doctor's surgery. It was 9 o'clock on a Saturday morning, but I was in Australia. The GP surgery was open. The doctor was right there. He'd wired me up and was on the phone to the nearest hospital. I was then taken to the nearest hospital, which was about a 20-minute ambulance drive away. They stopped halfway there to thrombolyse me, because by that time they were in constant contact with the cardiac unit at the hospital. By the time I got to the local hospital, I was feeling fine, feeling a bit of a fraud, to be perfectly honest. And the next thing I knew, I was being loaded onto the helicopter to be airlifted to Canberra. The helipad was above the 7th floor, which was the cardiac unit. So I was straight into the cardiac unit. Anyway, 3 weeks later, I came home because it was day 42 of my insurance policy. I checked in with my GP, and the first thing I asked is, would you please refer me for cardiac rehab? And within no time, I was given the choice of an appointment, either at Newtown, Rarder, and met Helen Hathaway, and I was just so impressed. I just was gobsmacked by her knowledge, her expertise, her attitude, the way she was so professional. She raced me round a gym to get my heart rate up. My heart rate, whatever I did, wouldn't go above 60. So she explained to me why that was and how my oxygen wasn't getting to my heart because my heart wasn't beating fast enough. And it was things that I would never have thought about myself, but she explained it. And it just gave me so much confidence to actually push myself a bit and got me booked in for the exercise referral at Newtown. And within no time, I was back with Kathy again. So my first few times at cardiac rehab were quite hard emotionally. And it made me realise that they really treat the whole person, not just the heart. You know, having come from a medical background, I have known many occasions where certainly specialists have treated their specialty, but haven't really seen people as a whole person. I hadn't realised that specialist nurses were just so professional, knowledgeable. Their specialist expertise was just amazing. And to be quite honest, I've come on in leaps and bounds throughout the rehab, and I really look forward to it. My 2 days a week where I think, yeah, this is something I'm doing for me. I'm sure I wouldn't have the same motivation if I was just doing it at home. So yeah, I mean, I actually can't praise the scheme enough. And having been seeing it as an observer for 9 years and then suddenly being part of it for the last year, it spurred me on to get back to normal, really. I recommend it to everyone. My one slight misgiving is that I think a lot of people possibly miss out on it because I'm not sure that every GP or cardiac department or stroke unit or whatever automatically tells people that there is an exercise referral. And I don't know whether it's offered to everyone or not, and it certainly should be.
What a very moving and powerful story. Paul, or I can see Elaine's come on screen. Conventionally, we haven't opened stories for conversation, and of course, time is limited in our meeting. However, I do think it is appropriate to offer some time for any brief reflections that anyone might have following these stories. So I'll turn firstly to Elaine, but if anybody else would like to offer a reflection, then please indicate. Thank you, Elaine.
Thank you, Carl, and just my thanks in the first instance to Jean for sharing her story and the story of Dave, which although had some really challenging elements to it, I think overall was an overwhelmingly
positive story about her and Dave's experience of the care that we provide in Powys with our partners, and indeed the care that she received in Australia. And I think the thing that stands out for me is how very human our services are, and how that human interaction and connection can make such a meaningful difference to people. And I wanted to touch on that very final point she made about referral, and just to provide that assurance that both the cardiac rehab scheme, which we offer in Powys, as well as the exercise referral scheme, is available to our whole population, obviously dependent on their needs. But that is available for referral through our GP practices, as well as from some of our other services. So our physiotherapists in particular will refer into our exercise referral scheme. So I think it's just really important that we recognise the availability of that, and also just that overwhelmingly positive impact that it can have for people. Thank you.
Thank you, Elaine. Do you want to pick up, Elaine, because Jean did say, didn't she, that she wasn't really sure whether the service, the scheme, was available through every GP practice, or even whether everyone that needed to be aware of it in terms of our primary care providers were actually aware of it. I just wondered whether you had a comment about that.
So it is available, and it can be referred to from every single one of our GP practices in Powys. Not every single service has referral rights into there. That wouldn't necessarily be appropriate. And certainly there is a criteria for people to be referred into the exercise referral scheme as well. I think there's a question there around whether everybody automatically gets offered that referral first time. My experience tends to be that our GPs tend to be very positive about the exercise referral scheme and very good at making those referrals.
Thank you. So can I just, on behalf of us all, add a very heartfelt thank you to Jean for sharing her story with us. I echo and endorse everything that Elaine has said. I think it was particularly interesting to have that first-hand feedback about how our health professionals are working together, therapists and the nursing staff, primary care, and in that very joined up way. And also, it was interesting to listen to how some of our temporary service changes are beginning to, or not beginning, or continuing to support people in a very effective way. And of course, we will be reviewing those as part of our Better Together transformation programme process. And so a big thank you to Jean, much appreciated. We will go on now to our staff experience story. It's lovely to have Olivia Jones with us today, an aspiring nurse, an apprentice nurse, and I will ask Deb, our Executive Director for People, Culture and Transformation, to introduce us to Olivia and to her story. Thank you, Deb.
Diolch, Chair. So as you say, today's staff story brings to life our amazing Aspiring Nurse programme, which we've discussed in many times. Therefore, I'm delighted to introduce Olivia, who will be sharing her personal journey and within Powys. Olivia's story reflects resilience and growth, highlighting how her experiences and the support she has received has led her to pursue a career in nursing through that Aspiring Nurse programme. Over to you, Olivia.
Oh, good morning, everybody. Bore da. Lovely to be in this meeting. It's an absolute privilege. So, yeah, I'll make a start. So I began my career in the NHS in November 2020. And that's a picture there of Llanidloes Hospital where I started. With this apprenticeship, it was an NVQ qualification, and I was based on Llanidloes ward. And this was during the height of COVID-19 pandemic. At the time, the ward was operating at full capacity with 19 beds and caring for all patients with wide range of conditions and needs. Looking back, this was a significant step into my healthcare career, particularly as I had previously worked in a factory and had no prior experience in caring for others. I quickly realised how much I valued the role, and I knew it was the right path for me. With the support of the team, I gradually built my confidence and developed my skills, including dementia awareness, person-centred care, infection prevention and control, and recording observations. Towards the end of the 12-month programme of the apprenticeship, I was invited to meet with the acting sister, who encouraged me to consider applying for the Aspiring Nursing programme at Powys Teaching Health Board. Initially, I was unsure, having seen firsthand how demanding the role of a registered nurse can be in a community hospital, from paperwork, phone calls, referrals, day-text reporting and assessments. However, after reflecting on the opportunity, I recognised the value of being able to earn while I learn. The following day, I applied to the Open University and submitted all the required documents. The waiting period was difficult, but I was delighted to receive confirmation that I had been accepted onto the course. In February 2022, I enrolled on the Aspiring Nursing programme. The course began with theory-based learning, which introduced us to the structure of the programme and the expectations of the nursing role. We were then allocated our first placements, which I attended alongside my substantive role as a healthcare support worker at Lanny Hospital. The programme is full-time, with my week divided 22.5 hours as a student and 15 hours as a HCA. In addition to placements and work commitments, the course requires completion of assignments, attendance to online tutorials, and regular study of module material provided by the OU. The academic component is delivered remotely, meaning I do not have to attend a physical uni, which has suited me well. At times, balancing these responsibilities has been challenging, particularly when switching between the role of a healthcare and a student, which can be mentally demanding. However, with strong support from friends and family and colleagues, I have found the determination to continue and succeed. Throughout the 4-year programme, all of my placements have been based with Powys Teaching Health Board. These have included district nursing, outpatients, GP practices, and the community dementia team. I have also completed spoke days with specialist nurses in areas such as Parkinson's, sexual health, diabetes, hockey health, and outpatient clinics, all of which have been highly valuable experiences. These placements have enabled me to develop new skills and knowledge while also strengthening my confidence in practice. Sorry, I've lost one. I have been fortunate to meet my wonderful people along the way, including patients whose experiences and kindness I will always remember. They are a constant reminder of why I want to be a nurse. The programme is 4 years in length, although this has recently changed for new cohorts. I am now approaching the end of my training and have successfully secured a role within district nursing team through streamlining. In a few months' time, I will qualify as a registered adult nurse with the Health Board. Looking ahead, I hope to continue to develop my knowledge and skills and eventually progress into a specialist nursing role. If someone had asked me a few years ago that I'd become a nurse, I would never have believed them. However, I now feel that I've found the career that is right for me. I am passionate about caring for people and working as a team. I am extremely grateful to my colleagues, previous supervisors and assessors for their encouragement, support and guidance throughout my journey. I've also made many valued friendships along the way. Although there were times I did feel overwhelmed and considered giving up, their support helped me to keep going. I am proud to now be able to share my story, and I hope it encourages others to join the profession. Thank you so much for listening.
Well, thank you, Olivia. Again, colleagues, should anyone want to share a brief reflection in response to Olivia's sharing her story with us, please do indicate. But I will invite initially the Executive Director of Nursing, Paul, to offer his reflections. Thanks, Paul.
Thanks very much, Carol. Olivia, thank you so much for sharing your story with us, and well done. That must have been very daunting for you to come on and to share that with us, and you did ever so well. So thank you. I pulled out a lot from that, but what was very warm and heartfelt from my perspective was your passion that you were able to demonstrate throughout your story. And when you found your niche in life, and some of us are very lucky to find that early in life, and you know it's the right direction for you, your dedication, your commitment to it demonstrates that it's the right journey for you. And I did hear during your story those challenging times, and as a nurse back in the day when I did my training, I can certainly empathise with you in relation to what that was like in those days when you thought, gosh, is this really for me? But that resilience, that perseverance and that support that you get, and those individuals that wrap themselves around you to support you on your journey, your mentors, your preceptors, your colleagues, the college, they're all the ones that help you guide along. And I think you are a real advocate and a real advert for our Aspiring Nurses programme. You are exactly what we want and what we need. And I really do enjoy looking forward to going out to meet you and have a chat with you in person about your journey and how we might promote that. But for now, well done. I absolutely acknowledge and recognise what a journey you've been on. And to get to the final bit now and find your niche in life is fantastic. And I really think you're going to do us proud in the nursing space. So well done. Thank you.
Oh, thank you, Paul.
Thanks, Paul. And our Chief Executive, Hayley, do come in, please.
Oh, Olivia, thank you so much for taking the time to share your story. And in particular, I think that those words Paul used, it's inspiring when we see how you've grown over the last 4 years and now you're a qualified nurse. And, you know, this is part of our own approach, which we want to give opportunities for people who are already committed to working and living in Powys to further their careers. And I think it's not an easy option, Olivia, working and balancing that healthcare assistant role with doing that training is a huge achievement. And I think, you know, well done, congratulations. And I really hope perhaps the team, the comms team, can actually connect with you, because I think hearing stories like from people like yourself will really encourage other people to come forward, because we do have a recruitment challenge and it is important that we're able to offer these pathways for development and training locally in the county. So congratulations, Olivia, well done.
Oh, thank you, Hayley.
And Olivia, on behalf of the board, I just want to add to that and say a really big thank you. It's quite a thing, isn't it, to come and present your story to board members in a public meeting. But you have done it absolutely excellently, and so we're really grateful for that. Couple of reflections from me. You know, I and colleagues do get out and about as much as we can across the organisation, and I think Simon Wright, independent member colleague, and I were out with district nurses at the end of last year, and I distinctly remember a nurse colleague of yours say to me, because she'd been on a similar journey, and said, you know, the flexibility of the Aspiring Nurses programme meant that she didn't have to choose between, and these are her words, between her family and her future. And that
Definitely.
really resonated. And I think that's come out in your story as well. And also your story, as I say, it puts flesh, if you like, on the bone of our papers today. And colleagues, later on in our meeting, we're going to consider the Integrated Quality and Performance Report. And you may have picked up that on page 10 of that report, under agenda item 3.2, there is some information there about the Aspiring Nurse programme and the fact that 36 new nurses will join our workforce over the next year, which is over 7 times what we have traditionally received from the streamlining process. And so, Olivia, again, you just helped that to bring that to life. And so a big thank you. And like Paul and others, I look forward to meeting you soon in one of my visits. So,
Yeah,
but for today, thank you very much. Diolch yn fawr.
you're very welcome. Thank you.
So on that very encouraging and inspiring note, we will move on our agenda. 1.5 on our agenda, as I mentioned earlier, is an opportunity to consider any questions that are submitted to us by members of the public. We don't have any questions for consideration at this meeting, and so there is nothing to discuss or to consider at this point in our agenda. So we will turn to item 1.6 and to our update reports. Initially, my report, my chair's report. I will take the report as read. I don't have any additional comments that I need to make, but I am very happy to receive any questions or to respond to any questions and to enter into discussion about any aspect of the report that colleagues might want to talk about. I'll pause that should anyone want to ask a question or make a comment in response to my report. There aren't any, so thank you for that. We turn our attention then to the Vice Chair's report. Rhiannon, our Vice Chair, can't be with us today. We knew that she can't be with us when she started her role as Vice Chair, and so this was always a planned absence. And so we certainly, it is absolutely understandable that she can't be with us today because of another commitment. I do want to add one thing to Rhiannon's report, if I may, and that's that as part of her getting to know people and getting to know the organisation, Rhiannon has met with Katie and colleagues from Llais, the Patient Voice organisation, and its regional expression of that for us in Powys. And so Rhiannon has done that, both in her capacity as Vice Chair, but also in her capacity as Chair of our Patient Experience, Quality and Safety, the PECS committee. And so I think it's just important to add that Rhiannon has done that as part of her induction and getting to know things. But with that addition to Rhiannon's report, does anyone want to ask a question or comment on her report? No? So that brings us to our Chief Executive's report. Hayley, again, we take the report as read. You may have some additional comments that you want to make. Please do.
Oh, thank you. Most of the report is read, but I just wanted to particularly draw board members' attention to a fantastic afternoon that took place on the 9th of May to celebrate our long service awards for our colleagues in the Health Board. Believe it or not, over 1,200 years of service were represented through the awards that we took place on the 9th of May, and really pleased that both Rhiannon as Vice Vice Chair, and also the newly appointed High Sheriff William Watkins was able to attend. And we had a wonderful entertainment from a local choir as well. So a really great afternoon, and really important to draw the board's attention to other colleagues' achievements as set out in the report as well. I know that a little bit later in my executive committee update, I'll be providing further information on the approach that we're taking to financial recovery. And as the board is aware, the NHS Wales Welsh Government process around oversight and escalation framework is now taking place and being implemented from this year on, and our first scheduled escalation board is on the 2nd of June, of which we will provide an update through to the next board meeting. And then the final, I just wanted to thank Pete Hopgood, Deputy Chief Executive, who will be attending the UK Parliament Welsh Affairs Committee on behalf of the Health Board in June, where the inquiry in cross-border healthcare services is taking place. So Pete is providing oral evidence on behalf of the Health Board, partly as I'm on annual leave abroad. So really grateful to Pete for picking that up as well. And again, we will report coming through from that session. So other than that, I wasn't going to particularly draw out any additional points. Thank you, Chair.
Thank you, Hayley. We do have some colleagues that want to respond, so we'll turn firstly to Robert.
Thank you, Hayley, for the report. Lots of good things in there. I'd like to concentrate, if I may, on the JCC update, which you included there. And in doing so, I acknowledge that, of course, our Royal Health Board is just one member of the JCC. Firstly, the report notes that at this stage, analysis does not demonstrate a consistent difference in ambulance performance between rural and urban areas. Information routinely provided to the F&P committee shows that the response times for ambulances in Powys are always slower than the Wales average, and in fact later on under section 3.2 we demonstrate that that position has deteriorated further. So I think there's an issue for me about how we can explain these two bits of information. Presume it's something to do with the definition of rural and perhaps how all rural areas are being compounded together. But in any event, for Powys, which of course is a big part of the proposal, the data seems to be pointing in a different direction, and this might well be the case for the vulnerable Cambrian rural strip identified those years ago and which prompted this solution in the first place. So it would be useful to know what the difference is, and perhaps we can return to that again. Secondly, I was very surprised that the option to cease development of recommendation 4 was being considered at all. And this after expectations had been raised on numerous occasions and in principle commitments made over several years, albeit with fine-tuning to follow. And the statement that recommendation 4 is separate from any decisions on air bases is clear, it is helpful, it's come from the judicial review, and the position of the JCC as stated in your paper appears to have changed since the 5th of February when their website reported that no final decisions will be made on recommendation 4 until more detail is available on further air ambulance base arrangements. So that things seem to have moved on. That's good in principle, good that R4 is being pursued independently of the air bases. Recommendation 4 was recognised as a worthy candidate for serious evaluation and adoption several years ago, as you know, and I'm sure that Powys residents and thousands of people did express their views, did not expect a rapid delivery of recommendation 4, but with more engagement planned, it does appear that this is taking much longer than we expected and certainly much longer than many of us hoped. And as an observer looking in, and this might be very unfair, but it is the way it appears, there doesn't seem to be the same urgency now as there was at the beginning when we had quite an energetic and enthusiastic promotion of this proposal by several NHS parties, albeit, as I said, several years ago. Thank you.
Thank you, Robert. Hayley, please do respond.
Yeah, thank you, Robert. Really important points. On the first point, which is around the performance position, my suggestion is that we bring further info. This is a direct exit out from the last Joint Commissioning Committee regarding the discussion that took place in the Joint Commissioning Committee. My suggestion is on the ambulance performance position, that clarification, particularly on the Powys position, we need to bring back further information on that. The work is being undertaken, particularly against the new ambulance performance framework, and therefore that analysis and information is part and parcel of what's being updated at the moment by the JCC for consideration. Your point around the separation and indeed the reiteration in the last meeting that the work on recommendation 4 should be continued. It has taken longer, colleagues. It was paused during the legal process, the work undertaken. There was original work done on the specification and the work was paused during that point. However, the JCC did agree that work would and should continue at pace to deliver on this, including re-engaging with key stakeholders, of which we've got a large proportion of our population, particularly in Powys, who have a particular interest and want to be a part of that co-production in terms of how we take that work forward. At the last meeting, we did request further detailed timetable and process of the work that would be taken around recommendation 4, and I am expecting a more definitive, detailed update on that work to come through to the next Joint Commissioning Committee. So my view is the work continues. We will continue to push in my role in representing the Powys discussions that we've had as a board previously, in making sure that the work is undertaken and is brought to a completion as quickly as possible, because I do agree, Robert, that there is some frustration that I have heard directly from key stakeholders that this has taken longer than originally anticipated, and therefore we do need to provide certainty to our population around what the outcome of this work will be as quickly as possible. That work is being led through a team in the JCC, of which we will form a contribution towards, and I can provide further update at the next meeting after the next JCC on the detailed plan that's been established to complete the work. I hope that's helpful, Robert. Thank you.
Yes, thank you. I'm assured. Thank you both.
Thank you, Robert. You make very good points and very clearly. Just from me, we will have an opportunity as a board to engage directly with JCC colleagues who are attending our board development session in August. And so in addition to the way in which Hayley represents us at the JCC formally, there will also be that more informal discussion opportunity. So thank you. Ronnie, please come in.
Thank you very much. Good morning. Hayley, as always, a very helpful report. Some questions from me, perhaps, which are predictable. First of all, in relation to the spring vaccination campaign on COVID and RSV, we are a few days away now from the beginning of meteorological summer. So I'd like to be assured that our spring vaccination campaign is on track. Secondly, on hantavirus, if press reports are to be believed, a 60-year-old British person and his travelling companion were apprehended in Milan for breaking their isolation. So I don't know where the self-isolation patients are in Wales, but I suppose my concern is just to see that the isolation is effectively administered against the very obvious potential for things to go wrong were it otherwise. And finally, on electronic prescribing and medicines administration, very good to see that that is in place in Llewellyn Ward. I'm not quite sure, though, as I read the paragraph, if it's of benefit to patients or if it's a financial saving or if it's a mixture of both. So it'd be good to just have clarity on that particular point if possible, Hayley. Thank you.
Oh, thank you, Ronnie. And I'm going to defer the response to our Director of Public Health, Mez, for the points that you raised initially. And Kate, could you come in on EPMA as well, please? Thank you.
Okay, Bore da, Mesbury, Director of Public Health, and thank you, Ronnie, for your questions. So in terms of the spring vaccination programme, just to note, as in the paper, we have had an expansion to the RSV programme to offer the RSV to residents of care homes, and also extending the programme to over 80-year-olds, and that's in response to JCVI evaluating earlier programme that showing the effectiveness of that vaccine in reducing hospital admissions. So in terms of the rollout of the programme, commenced in early April, and on track to invite residents by the end of June, but also to say in terms of the RSV programmes that will continue into July and August as well, to offer protection before the autumn winter respiratory viruses. And then obviously we're planning also for a winter campaign for COVID as well currently. And then in terms of the Hansa sort of virus element, is to provide assurance that we are participating in a daily IMT by Public Health Wales, and responsibility for monitoring any contacts in the UK sits with UKHSA in England, with support from local authorities and Public Health Wales in Wales in terms of daily phone calls, but also supported by the local authority areas where individuals may be residing element. So there are processes in place and close monitoring with support from the health boards as well. Perhaps. Thank you.
Kate, do you want to respond to the EPMA observation from Ronnie, please?
Yes, of course. Thank you for the question, Ronnie. And so we are rolling out to our first ward currently, which is brilliant, and massive thanks to the teams who've all worked extremely hard to get to this stage. So it is really exciting. So in terms of the two questions, then in terms of safety, there are significant benefits. So we know that this will reduce medicine errors, medicine administration and prescribing errors, which is really important. It will allow us to have a much closer look and audit at the medicines that we're prescribing, which previously would have required manual looks through drug charts and stocks. So that will not only increase efficiency, but it will allow us to look for opportunities for quality improvement in terms of prescribing as well. In terms of the staff, then it's much easier to use. They're all being trained as we speak, but it is more efficient and will help them. So far the staff are loving it. And also, given our geography, it helps with remote work. So we can have, for example, an out-of-hours GP in a base who will be able to more safely remote prescribe when appropriate. So those are the main. There are many benefits, but I think those are the key ones. There are some financial savings. I think it was identified that they would be relatively modest, but I think we all know that as we embed, we will learn more. And I think the potentials are probably greater than we've anticipated, but I think we can't really know that until we get up and running. So I think the benefits of both, but the big benefit is quality and safety, which is key.
Thank you very much.
Thank you, Ronnie. There are no other colleagues wanting to contribute in response to the Chief Executive's report. So once again, thank you, Hayley, for the clarity and succinctness of the report. Thank you very much. We then turn to item 1.7 on our agenda. I mentioned earlier in my introductory comments, and I think it's always useful to just to bring this out in our meetings, that our meeting today is a bit like the tip of an iceberg. Our board business and our board work extends quite extensively from and underneath these public board meetings, and not least in our subcommittees, where the detailed heavy lifting of monitoring and scrutinising takes place. And therefore, again, as I intimated earlier, the committees are key sources of assurance to us as a board, and the chairs of those committees are very important conduits, if you like, or custodians of that assurance. And so what we have under this agenda item are reports from our various committees as that source of assurance, and an opportunity not to repeat or duplicate the discussions and the scrutiny that's gone on in the committees, but for any board member to ask a question or to pursue discussion about any aspect of the committee's work. So we turn firstly to our ARAC committee, to the Audit, Risk and Assurance Committee, and to its chair, Steve Elliott. Thank you, Steve.
Good morning, Borodar. Steve Elliott, independent member for finance. The meeting we had last Tuesday was just before the papers for this board meeting were due to be produced. So we've just got a summary report today, and a full report on the meeting will be provided at the board meeting in July. As you say, Carl, we have got an item later on the agenda which was considered by the committee, which is the board assurance framework and risk management framework policies and the risk appetite. So we can obviously cover more later on, but otherwise I don't intend to say any more at this point, but I'm happy to take questions.
Thank you, Steve. Colleagues, please do indicate if you have a question or a comment in response to the ARAC report. There are none. Therefore, thank you very much, Steve. We will move now to the report of our F&P, Finance and Performance Committee, and its chair, Ronnie.
Thank you very much, Carl. This is an extremely brief report from Finance and Performance, only 2 pages, and that is, as was the case, as Stephen mentioned a moment ago, we met on the 14th of May, just a few days ago, and so many of the issues that we discussed and considered are actually covered in section 3 of the board papers today. So I'm taking the report as read. There's nothing I want to reference particularly, but happy to consider any questions or observations. Thank you.
Thank you, Ronnie. Again, colleagues, please do indicate if you would like to ask a question, make a comment in response to the F&P report. No, so thank you. And I will come back to Ronnie and Steve later on in our agenda, should you have any additional words of assurance on the part or on behalf of your committees, particularly when we come to section 3 of our agenda on performance reporting. Without any further ado, let's turn to the report of our PECS, the Patient Experience, Quality and Safety Committee. Its chair, Rhiannon, as I explained earlier, can't be with us today, and I think Helen is going to make some comments on her behalf. Thank you, Helen.
Thank you, Carl. So pleased to provide the full report in front of you. PECS last met on the 30th of April. 6 points I wanted to draw out on Rhiannon's behalf. Firstly, there are 2 escalated items, as you'll see in the report, that PECS has been keeping a very close eye on. The first one, Children's Neurodiversity Services. That's a continued item that appears at the committee on every meeting. The second one, the People's Experience Framework. The committee have made the decision to de-escalate this point now from its committee, and therefore recommending that to the board. Just for context, this is quite a long-standing escalation. It was in context of the Civica system. That's the mechanism which the health board, one of the mechanisms that the health board uses to essentially collect patient feedback. The initial escalation was in relation to the health board's ability to be able to implement that system from a capacity perspective, and several steps have now been taken and assurance provided that that issue has now been resolved, and in the future continues to form part of our wider patient experience framework. 4 items just to briefly mention in terms of assurance. The committee were very pleased to receive the refreshed integrated quality report. Paul and his team have led that and was in part in response to the structured assessment report that we received a few months ago. They also spent some time considering the annual clinical audit programme, the infection prevention and control quality statement, and received an update on the test and post-sexual health service that Public Health Wales are responsible for running. Happy to take any questions, Carl. Thank you.
Thank you, Helen. Colleagues, do indicate if you would like to ask a question or make a comment. Just whilst people are thinking, an additional comment, if I may, from me, Helen. You're absolutely right. The de-escalating of the Civica item is because it was a very specific item about capacity, which has now been addressed. I think there is still the wider issue that PECs, and indeed we generally as a board, are interested in, is how we bring greater systematisation to the capturing of patient voice, patient experience, and helping that to influence our decisions and deliberations and so on. And as you quite rightly say, in our September meeting, following PEC's consideration, we will be receiving a draft or a proposed patient experience strategy deriving from the patient experience framework, which we are looking to that to address that wider systematic question. So I just wanted to kind of make an additional contextual point, really, but please do come in if you think that I've got any of that incorrect.
No, Carl, that's absolutely right. And Paul may want to comment, but you're absolutely right. That patient experience framework will be in response to the National Welsh Government framework, but will also put into context our more unique position in Powys as a provider, but also a commissioner of services as well.
Yeah, thank you. So I can't see that anyone wants to ask a question or make a comment in response to the PEC's report. So thank you, Helen. And we turn our attention to the PPPH report. The number of P's always trips me up, but this is our Planning, Partnership and Public Health Committee, and I'll invite Robert, its chair, to present the report. Thank you, Robert.
Thank you, Chair. The last meeting was 2 days ago. What I'll do at the next meeting is to provide an update on the 3 health prevention projects that we discussed. But for now, I'd like to highlight just one item, which I hope will provide some assurance to people looking in. We are living through a veritable an ocean of service reconfigurations and rationalizations, largely prompted by the need for health trusts and boards to become more efficient. And for us, the key document is the Strategic Change Report, many pages long and expertly overseen by the communication and commissioning arms of our health board. And in our committee, we've had first sight of some of the communications and representations made by executive on behalf of the board to those organisations proposing change. And the committee was assured that the executive were not only capturing such changes, but also interrogating provider organisations on the impact of the proposed changes in a measured but persistent way. And the 2 questions that are being asked are, firstly, to what extent will changes within one provider impact on people within Powys? And the second is, what is the cumulative impact of changes, for example, the reorganisation of stroke services, across several providers doing to our Powys residents? Of course, assessing the impact, making representations does not guarantee that we can influence outcomes in all cases, but the Health Board will continue to make the case for a more unified approach to plans across Wales. And in the meantime, behind the scenes, the Health Board is looking at mitigating actions to reduce the impact of likely changes. So just a glimpse, if you like, of the work that goes on behind the scenes. Thank you.
Thank you, Robert. Important points. Colleagues, once again, please do indicate if you would like to respond to the report from the PPPH committee. And if there are none, then we go finally under this section, but certainly not least, to the chair of the executive committee, the chief executive, Hayley Thomas. Thank you, Hayley.
Thank you, Chair. So the majority of the report I will take as read, and you can see the breadth of topics and issues we've been dealing with through the 5 executive committee meetings reported. But I particularly wanted to draw attention to the establishment of our new financial recovery board. This is in direct response to the independent review undertaken by Grant Thornton. I chair this meeting and all members of the executive team attend. We also have alongside us that external support and expertise to make sure that we can move forward with strengthened oversight in response to the very serious financial position that we're facing, and as board members are aware, at level 4 escalation. You'll see from the report that some of the key focus of the first 2 meetings are included in this particular paper, but I wanted to offer some further update that we have taken a different approach in looking at our savings plan, in particular with regard to de-risking and identifying the right level of action and planning in order to be able to meet the requirements as set out from Welsh Government against a RAG rating, where we've got to give confidence around delivery of our savings. You'll see from the report that the last meeting on the 6th of May referenced a £14.2 million gap against our current plan. I wanted to offer the board further assurance that there is a new approach we've implemented, which is a financial sprint approach last week, which involved not only executive but other members of the team to take further action around the detailed planning relating to this. And we also held another financial recovery board yesterday, which Pete Hopgood, the Director of Finance and Deputy Chief Executive, chaired. And I'm very pleased that we've made substantial progress around the confidence in the delivery of our savings, which we will be reporting through to the next public board, but will also form part of the update that we offer to Welsh Government in our first escalation board as part of the new arrangements on the 2nd of June. So I wasn't going to draw any additional points, colleagues, just happy to take any questions. Thanks.
Thank you. Simon, please do come in.
Thank you, Chair. Simon Wright, independent member. Hayley, just to note that the Financial Recovery Board, as a subcommittee of executive, wouldn't normally report in the manner that you've done today to us, and to say, certainly for myself, that's a really welcome development. It reflects the Grant Thornton priority attached to the governance around ensuring we have assurance of the steps being taken on that road to recovery. So really just wanted to say thank you, and this is really welcome, and the assurance you're able to give us on the trajectory that we and the steps being taken for financial recovery is really welcome. So thank you.
Thank you.
Colleagues, would anyone else like to respond to the report from the Executive Committee? No? So thank you, Hayley. Appreciated. I'm going to go back now and invite Helen, our Director of Corporate Governance, because at the head of this agenda item, we had a list of all the matters that had been escalated to board from the various committees and that remain on our list of escalated issues. So Helen, would you like to make a comment on those and perhaps offer an update, please?
Lovely, many thanks, Carl. So there are 4 items that remain escalated from the board's committees to the board. We've covered a number of them today, but just to summarise, excuse me, 2 of those are from our PECS committee. I updated on both of those earlier on in relation to children's neurodiversity. We will continue to report that to the board. The other one was in relation to the specific point on Civica, which the committee have agreed and are recommending to de-escalate. The other 2, one is from Finance and Performance Committee. That's in relation to our organisational status in terms of escalation. That will continue to report through. And also the other one was Executive Committee in relation to the NHS Wales app functionality. And we covered an update on that earlier in the agenda when we heard from Hayley and Claire, but we will continue to report clearly on that one. So they're the 4, Carl, that will now become 3 in the future. Thank you.
Thank you, Helen. So just for clarity, Helen, in terms of decision making around escalated matters, so the de-escalation of the Civica capacity matter from PECS, that's a decision for PECS to make. You're not asking us to make a particular decision about that. Your PECS is reporting to us that that matter is now de-escalated.
That's correct, Carl. But of course, if the board are not content with that in any way, please do flag that and we'll take that back to PECS committee.
Okay, thank you. Again, I will pause just should anyone want to come in response to any of the escalated matters. And particularly, of course, the de-escalation of the Civica capacity issue. No, so we'll assume that all of that is supported. Thank you, Helen. Our Regional Director of Llais, Katie Blackburn and colleagues, can't be with us today because they are attending their own Llais board meeting. However, we do have, as part of our papers, the Llais report. We haven't received any additional comments that Katie wants to bring to our attention today, and therefore we will take the report as read. But does anybody want to ask a question or make a comment in response to the Llais report? Mick, please do.
Thanks, Chair. I apologise, I forgot to introduce myself when I made my first contribution. Mick Janassi, independent member. We've seen this analysis emerging incrementally through Katie's regular reports, but when you see it presented like this as an annual programme with almost 1,300 contributions from across Powys, it does paint a fairly consistent in terms of themes and in some parts quite sobering picture of people's lived experience. And I appreciate that it's not evidence, it's intelligence, but as a means of triangulating what we see and hear from other sources of assurance, it is quite insightful. And it kind of recognise that many of the wider system constraints are not fully within our control, and we have programmes like Better Together and the Grant Thornton work, which are intended to address some of the more structural challenges around funding capacity and cross-border care. But what came through quite strongly for me was the experience of services not feeling particularly well integrated, especially across health and social care. So there's examples of poor coordination, weak communication, people have to chase the system, lost records and analysis, and those things just feel more within our influence to improve, perhaps in partnership with others. So more a question for the exec team rather than Katie, really. But could you just say some more about how what we're actively doing to improve coordination across health and social care, make services feel more joined up for people, and what evidence do we have, if any, that is leading to tangible improvements in people's experience?
Thank you, Mick. Hayley or Elaine, which would you like to respond, or would you like to invite one of your colleagues to
I think I would suggest a few of my colleagues may want to come in on the particular point around addressing the theme of integration, perhaps Elaine, and then perhaps Nick and Paul may want to come in terms of how we're handling the Llais insights in particular and triangulating that with what we've got from other sources as well. Elaine?
Yes, thank you, Hayley, and thank you, Mick, for the question. And just to note, in the same way as you did, I forgot to introduce myself earlier as well. So I'm Elaine Lawton. I'm the Exec Director for Primary Care, Community and Mental Health with the Health Board. I think that point about how well we integrate and how well our teams work together, particularly when it comes to communication, whether that's about care plans or shared records, is a consistent theme that we see. I think there are areas where we are working really well together. That doesn't necessarily mean we've got to a concluded perfect position. So I think that there are specific teams in the community. If we think about our reablement and enablement teams, how they work together, how they identify which patient each team is best able to help and communicate and share that information, that works really quite well. But there may well be other areas where our population believe we should be communicating where maybe we aren't. So I think having this information come through to us in a timely way, having that come through to us in an explicit way as well, will help that ongoing process of joint working that we do with the local authority. We have a number of mechanisms in place. So through our regional partnership board, we also have a regional partnership board executive team that brings the key leads together for each organisation with the local authority. We have the joint leadership team, and I have regular meetings with the director of social care as well. So we have mechanisms in place that allow us to routinely address where there are identified problems. We also have teams that meet locally with GP practices, for example, through our enhanced community care programme. So we have systems and mechanisms in place. I don't think we've got it right. I think, however, we do have the mechanisms for a constant improvement focus. So I think this report really helps us with that.
Thank you, Elaine. Do other colleagues want to comment in response to Mick's question?
Carl, I can see Nina would like to come in if possible.
Okay, please do, Nina.
Good morning, Borda. Nina Davis, the Director of Social Services and Wellbeing for Powys County Council. Firstly, just obviously we always find the information we receive from PLICE really insightful. We have regular updates, and I have regular meetings with Katie Blackburn as Director to discuss the findings, the next steps, etc. And I agree with you, Mick. It comes through really strongly, doesn't it, and very powerfully in terms of the concerns across Powys and that integration. So it's absolutely something that we've picked up on within this report as well, and we'll be discussing further. I think Elaine has set out really well all the kind of joint working mechanisms that we've got in place. She's mentioned, the joint working through the joint leadership team, through the regional partnership board, and of course I meet regularly with Elaine as well. But this absolutely is an area that I think there's more to do. There's areas where things are improving, etc. But I think there's absolutely more that we can do in this area together, and we'll be working with our teams jointly to improve where we can moving forward. But thank you for the question, and absolutely agree on the importance of making sure we get this right.
Thank you. Paul, please add to that if you want.
Yeah, I would agree with everything that Elaine and Nina have just highlighted there in terms of our joint working, and equally would agree there's more to do. Just to add additional assurance, we meet with Powys on every Friday morning. Our concerns team meet with Klaus to go through our concerns, and where there is issues around concerns or issues around joint working, we address them there as well with Klaus. But additionally, we also meet from a safeguarding perspective. There's a very well established joint regional board where we're looking across both social services and the health board and working together on issues relating to safeguarding and safeguarding concerns. And equally within the infection control space, we've set up joint meetings as well where we're looking at issues around infection prevention and control. So there are very good pockets of areas where we're doing this really well, but would agree there's more to be done in the space.
Thank you. So a final comment from Nicola, and then we're going to move on to a different question. Obviously, Mick may want to come back on any of this as well. So thanks, Nick.
Yeah, thank you. It is really useful to have the summary from Llais picking out those themes, and they are remarkably consistent across all our areas, aren't we? And I think we acknowledge that. We had a similar presentation and feedback from Llais to inform the annual plan. Board members will remember that. Katie presented that at one of our board development sessions, and we responded to those in our annual plan, and really importantly we continue to respond to them through our Better Together programme. So many of the things that we'll be taking forward, particularly on planned care, respond to the themes that we often have about maximising the use of services in Powys as a provider, reducing travel, using other means of communication, and so forth, as well as the dental themes and those issues about operational communication. So it is really useful to have it, but just to reiterate that we did have a similar conversation to inform the annual planning process, and we continue to use that through Better Together, as well as our own engagement. And again, many of those themes are similar that come through our own engagement as well. We had on a sort of how we liaise with Llais. We meet with Llais on a fortnightly basis to talk about any delivery issues or operational issues that have come through as urgent topics, but also to continue to talk about our planning and delivery on a more strategic level. We had over 55 representations from Llais last year as well, and on particular topics, and we respond to those individually every time, and have put in place a good system for doing that, so that that is done with some rigour and consistency. It is useful to have the report today, but there is a lot of work underlying it, so that we're constantly taking into account in both our planning, our delivery, and our communications back with Llais and our communities. So thank you, Mick.
Mick, would you like to respond or come back in on any of that?
Yeah, thanks, Carl. I mean, it's reassuring there are clearly mechanisms in place. There's clearly kind of energy and effort that sits behind it. It's good to hear from Nina that it's kind of reciprocal. So that's quite helpful. I guess the question for me is, how do we evidence the fact that these contributions have made a difference, and how do we feed back to people that actually stepping up and sharing their experiences of some value and has made a difference. So the kind of you said we did. How do we feed back into maybe through Llais or other means that actually there is a point in raising these issues because people do listen. So it's it's not a question I'm seeking an answer to, just a thought that maybe we just need to think about how we evidence change as a result of this feedback, and how we feed that back in so that people don't feel that they're kind of communicating into a void.
Thanks, Mick. So I don't know whether anyone wants to come back in on that. I wonder whether Mick's final point about closing the loop, might that be picked up in the patient experience strategy that I talked about earlier in response to the patient experience framework? But perhaps Paul or someone might just want to come in with a final comment about whether or not that will be the case.
I'm happy to comment on that if that's okay. So in terms of currently, we do some of that already. It forms part of our reports back around patient experience that we report back into PECS. But you're absolutely right, Carol. We will strengthen that as we develop our patient experience framework stroke strategy, and Klaus play a big part of that, and equally will be members of that committee going forward, and already come to that committee. So they're the opportunities where we can feed back and then feed that back into the PECS committee going forward, and then ultimately into board.
You content, Mick?
Yes, thank you. Thank you very much.
Okay. Thank you all, and thank you to Katie and Clyde's colleagues for the report, as always. That brings us to the consent agenda under section 2, and as I explained earlier, this is now an opportunity for any colleague to request that any of the items currently in section 4 of our agenda, the consent agenda section, to request that any of those be removed from section 4 and placed as a substantive item for discussion on our agenda. Mick, please.
Thanks, Chair. I'm not asking for any papers to be withdrawn from the consent agenda, just to be clear, but I did just want to briefly flag a point, if I could, about the annual committee reports. So in both PECS and ARAC, we acknowledge that the reports were very well written, they're very comprehensive, and they provide a technically compliant record of the work undertaken by committees. But we also discussed whether in future there's perhaps an opportunity to go a little further, not just describing what the committee did, but also drawing out the impact of that work. So, for example, where did we gain assurance? Where was assurance more limited? What contributions did the committees make to effective corporate governance? So Helen was part of those conversations, acknowledged that that was worth looking at, not just for those two committees, but more generally across the piece. So, I'm not seeing any immediate action. It's a consideration for the future. But I just thought I'd flag it up as an opportunity going forward to strengthen our governance arrangements. But just being very clear, I'm not suggesting that the paper is brought out. Thank you.
Thanks, Mick. Helen, do you want to come in with any observation around Mick's suggestion?
Yeah, thank you, Carl, and thanks, Mick, for the comment. I agree with you. That would certainly add value to the way in which we report. I think as we discussed in those two committees, we need to think about how we do that and make sure that that's proportionate to the resource that we have, but also meaningful to the board. But I absolutely agree with your points, and we will undertake to explore how we do that. Thanks, Carl.
Thank you. So the consent agenda under section 4 remains as is, and we will deal with that in due course, which brings us to item 3.1 on our agenda, the financial performance report that will be introduced by Pete, our Deputy Chief Exec and Director of Finance. Thanks, Pete.
Yeah, thank you, Carl. Morning all. So included in the finance report in this month is our month 12 year-end position for last financial year and our month 1 position for the new financial year. So starting with the month 12 report, this is our outturn financial position. This position is as reported but subject to the end of year annual accounts audit process. So in terms of our revenue position, we reported a year-end overspend position of 33.275 million. That is in line with our deficit forecast. And against capital, we reported a total spend of 8.312 million, which is within our capital resource limit of 8.393 million. I think if I just pull out a couple of key messages, and then we can spend some time with any questions and comments and further discussion. So in terms of our revenue position, the key message is that the main contributors to our underlying deficit, which is 45 million, are our spend on healthcare services provided by other bodies, our spend in relation to complex care, CHC, our spend in relation to mental health private providers, and generally our pressure against spend in relation to our provided services, which in the main is in relation to mental health. Included in the report is the usual analysis against our key expenditure areas. Worth noting in relation to our provider services, we still are running with a significant level of vacancies. That does have a knock-on impact in terms of our use of agency. The usual analysis is included on page 4 of the finance report. Pleasing to note that our overall average spend is lower year on year compared to previous years, but do note that we did see a spike in our spend in month 12 of the financial year. The usual analysis is included in relation to our commission services, with the pressures has been previously discussed at board. Also included is the analysis against our private providers and their use in relation to capacity for mental health and learning disability patients. Also noting that although we've seen improvement in relation to our hospital delays, it still is an area of opportunity and an area for improved efficiency and a cost within our position. Also included the analysis of our prescribing position, the pressure in relation to growth, but also the good performance in relation to savings. And similarly, the analysis of our CHC, which has seen continuing healthcare, which has seen a growth in the number of packages and the cost of those packages. What is pleasing to note against those significant areas of pressure is our delivery against our savings target in the last financial year. So against the target of 23 million, we have delivered just under that target at 22.85 million, which is a significant achievement for the Health Board, and a big thank you goes out to all budget holders, all controllers of spend, and all teams involved in identifying that improvement and that efficiency and those savings. Also pleasing to note that we did exceed our target in terms of recurrent delivery, delivering 10.4 of that 22.8 million on a recurrent basis. That is a positive, but also note that the fact that we've delivered a level of non-recurrent savings that does contribute to our ongoing underlying deficit is the primary reason for why our outturn position and our underlying deficit is different, whereby 33.3 million outturn position and underlying deficit of 45 million. Final point to note is we continue to have a risk in relation to the disputed invoices received from Wide Valley Trust. The details included in our financial report. It was discussed at length in our Finance and Performance Committee and is included for the board to be fully aware of. I think they're the key messages from me, Carl. Happy to take any comments and questions.
Thank you, Pete. So building on my comments earlier, I will invite initially Ronnie as chair of our Finance and Performance Committee, just to share any feedback from your committee, Ronnie, as a source of assurance, because you looked at this as a committee in some detail. I will then invite Steve Elliott, who is our independent member for finance and indeed chair of our Audit and Risk Committee as well, to offer comments following Ronnie. But first to you, Ronnie. Thank you.
Thank you, Carl. We had a wide-ranging discussion on finance at Finance and Performance Committee. I think we are assured in relation to the issues that we have raised. But with your forbearance, I'm going to ask another couple of questions now, if I may.
Please do.
Pete, just looking at page 4 and the fact that we are still an outlier on forecasted agency and locum spend, we are still showing a 3.6% increase over average. I just wondered if there was anything further that you wanted to reflect on in relation to controlling that particular dynamic. And then, Pete, this question may not be for you directly, but in relation to those patients who are in mental health private provider status, I just wondered if I could be assured that actually the patients who are in that position are regularly reviewed in order to make sure that that private provision is actually necessary. And is there any potential for us to reduce those costs as a consequence? Thank you.
Pete, you may want to bring in other colleagues to answer those specifically. Please do.
Yeah, thanks, Ronnie. So I can add a couple of general comments, and I'm sure others will like to come in on the specifics. So in relation to our agency spend, yes, we are an outlier. We've been regularly reporting that. We do note our significant improvement. There is a raft of actions in this area in terms of ongoing recruitment, our grip and control. We've recently completed some self-analysis against a control matrix in relation to our HR processes, and that report went to our People and Culture Committee fairly recently. So that's an ongoing area of focus. It's probably an area that Deb would like to come in and add some further comments on, and then we'll pick up on the mental health private providers. Thank you.
Thanks, Pete. Just by way of slight correction, the grip and control on pay areas is going to a forthcoming People and Culture Committee.
Thank you, Deb.
No, it's fine. Just back to agency, just in support of what Pete said, we did a significant amount around community wards, and we saw the improvement that yielded. So the next part of the plan, which is already in place, is that we are now focusing on mental health and off-ward agency. Just on mental health, one of the areas that has taken us a while to reconcile, but is now reconciled, is the establishment needed on both ward areas and for medical. So medical posts that were attracting medical locum posts. Executive Committee have recently signed that off, so that allows us to really focus in now on recruitment to healthcare support workers or medics. So I would imagine that we'll start to see the improvement on those areas in this financial year, and to remind ourselves that, again, we've got a 30% reduction on the outturn on agency as part of the plan this year.
Thank you. Elaine, would you like to speak to Ronnie's question in terms of patients in private mental health provision?
Yes, absolutely. And thanks for the question, Ronnie. So we have an established weekly review meeting for all of our patients in those external beds. That is held with our clinical teams as well as support staff to manage that, and the focus is very strongly on the reviews and the repatriation back into Powys where that's clinically appropriate to do so. I would add to that as well, we also have now a plan around reviewing some of those private provider placements, looking at the contracts that we have with different organisations to manage the spend accordingly as well, and that's being managed through the Financial Recovery Board.
Thank you. Carl, if I may, what I will say is that the committee will continue to look at these issues and other issues on an ongoing basis. Thank you.
Thank you, Ronnie. So, Steve, would you like to come in and offer any further reflections, source of assurance?
Yeah, thank you. I think first off, we shouldn't really understate the fact that the organisation has ended up with a deficit of £33.3 million at the year end. And obviously that's quite significantly more than the plan that we did approve for the year last March. However, the reasons for the increased deficit have been set out clearly in reports to the committee and to the board throughout the year, and they're well understood. The outturn is in line with the forecast position that the organisation has been reporting to Welsh Government certainly since Christmas. And it's also important to know that several of the contributing factors to the deficit have been outside the direct control of the board, particularly in relation to changes to the pricing arrangements in England. Just to reiterate what Pete said, the committee did recognise a significant achievement in delivering just short of £23 million worth of savings in year, and this amount far exceeds what's been delivered in recent years, and as Pete says, required action at all levels throughout the organisation. So the committee were keen to ensure that staff were thanked for the efforts in delivering these savings. And also the committee commended the significant achievement in delivery of the capital programme of 8.8 million last year, and again for thanks to go to all staff involved in that achievement. And of course we look forward to receiving the final accounts confirming this outturn, which we're due to consider at the end of June. Thank you.
Yeah, thank you, Steve. And I just want to reiterate and support your point, Steve, around our end of year position. Clearly, we are very, very acutely aware as a board that financially we are not where we need to be, and we have plans in place to recover that situation over time. However, notwithstanding the increases in English tariffs and so on that arguably were unforeseeable, we did end the last financial year in line with our plan, and that certainly is, for me, a very important matter. So a very important point that I just wanted to reinforce and support Steve. Thank you. We'll go to one or two other colleagues. Perhaps I might take 2 or 3 comments together, and then we'll come back to Pete or others for response. We'll go firstly to Jen, please.
Diolch yn fawr, thank you. Jennifer Owen Adams, independent member. One of the first point I'd like to make a comment, which Steve, you've already covered, which is to commend really the incredible achievement of our savings target last year. So of a target of £23 million, we came in just short of that. And I think we should recognise that that is on top of savings that were made the year before, and of course then we also will have a savings target for 26-27 as well, so that is a significant achievement. My question is, how do we risk assess the impact of those savings as a result of decisions which executive members make? How do we risk assess the impact of those savings, both individually but perhaps more importantly as a whole, recognizing that some of the actions which result from those savings will start or may already be starting to have knock-on effects on one another, and I'm looking for sort of a view as to how we track that and how we monitor that to ensure that we are able to proceed in delivering our whole services as efficiently and to the quality that we would like. Thank you.
Thank you, Jen. Let's go to Mick and then to Simon, and then we'll invite Pete to respond.
Thanks, Carl. My question was similar to Jen's, and just nailing my colours to the mast. Pete, as we've said many times, this is a very clear and very accessible paper for people with a non-financial background, and just thank you again for the effort that you and the team put into presenting it in such a clear way. And although as Carl has said and others have said, this is not a comfortable position to be in. The paper gives me a very clear sense of grip and control, a good understanding of what's driving the underlying longer-term deficit, which personally I find quite reassuring. And as Jen says, the savings performance, particularly the extent to which we exceeded the recurring elements, is quite impressive actually when you look at the the position we're in. But a bit like Jen, I just kind of wonder about the impact of some of these things. So if I look at page 51 of the board pack, there's the table there about provided services on page 3, and we show an overall underspend of 3.9 million, which is not that significant in the grand scheme of things, but that's offsetting a nearly £7 million overspend in mental health and learning disabilities, which I suspect is largely around agency. And that appears to have been achieved through quite a significant underspends elsewhere. So 9.3 million in corporate and other services, which is around about a fifth of what we plan to spend. Roughly 3.5 million in non-pay provided services, which is around 15%. So I appreciate that some of those may be in those planned savings, but can I just check what that actually means in practice in terms of operational consequences? So what have we not been doing? What have we done differently? What have we slowed down to deliver those reductions? And I suppose the concern is that we kind of, are those actions generally contributing to long-term sustainability, which will reduce the underlying deficit, or are we storing up capacity or delivery challenges for the future? Does that make sense, Pete?
Yeah.
Yeah. Okay. If we go to Simon, please, Pete, and then come back to you, because then we probably need to move on from this agenda item. Thanks, Simon.
Thank you, Carl. So just to echo others' comments on the accessibility of the report, and thanks to the teams for the delivery on the savings, which is really significant. I just wanted to pick up the Wye Valley Trust invoices and to note this was escalated to Welsh Government nearly a year ago, May 2025, and we are now reporting a further 8 million invoice risk. So I just really wanted to get some assurance of, do we know what is happening on the Welsh Government side to seek to rectify this, given they are supporting our position, and what kind of timeline do we think that might take? Thank you.
Thanks, Simon. Back to you, Pete, or indeed any other colleagues that you'd like to bring in.
Okay, thank you. So there's a lot in there, and probably some of the levels of detail we'd need to go in will be best covered in a Finance and Performance Committee, but I'll try and answer those as best I can. So in relation to the decisions, the impact on quality and other factors that Jen raised, I think the key thing to say is any action identified, it is assessed with depending on the scale of that action. That impact assessment, if needed, is completed. We have a clear understanding of the expected benefits, and we will monitor for any unforeseen consequences of those actions, and if needed there would be corrective action around that. In terms of what that means clinically, operationally, I'll let others come in and comment on that. In terms of Mick's question about how we manage our position, there will always be it's probably a similar comment actually. There will always be some non-current opportunities, non-current benefits that we can bring into our position. Those things can benefit in year. If they're not recurrent, they do not help with our underlying deficit, and that comes back to the difference between our outturn position and our underlying deficit being more significant. But part of the process, part of the position we're in, we do encourage all areas to minimise their spend, to reduce expenditure where possible, and help to contribute to our overall financial position. I think it's fair comments and questions. If there's any further detail or specifics required around that, then we can look at that and look to take something further to Finance and Performance Committee, if helpful, if that will help understanding, or if it will help lead to any different decisions or actions being taken. In relation to Wye Valley, we did discuss this in length in our Finance and Performance Committee. So this is clearly a debtor-led position whereby a charge has been raised, which we do not recognise, do not see as being a valid charge, and we do not recognise has been escalated to Welsh Government. They're aware of our position, and that is basically the position as it stands. So for us, that position is resolved because it's not a recognised charge for us. And hopefully I've covered the points there in terms of the quality, service impact. Maybe Kate or others may like to add to that.
So if we turn to Kate, our medical director, for any additional comments, particularly on the quality impact of savings and any operational consequences, Kate. Thank you.
Yeah, so thank you. Really important question. And just for assurance, then I think we have those conversations all the time. So right from the very start of any decision making and all the way through. So much of this is about awareness. And again, to repeat, we are constantly considering that and really working very, very hard to make sure any efficiencies are as far away from patient care as they possibly can be. There is triangulation, so it's really, I think this is where staff are really important. It's the unintended consequences that probably concern the most, and that's why listening to patients, listening to staff is really, really important. So there's a huge amount of triangulation going on, and I think it is about a really broad awareness. I think what can be lost is a lot of the really high in sort of the big, in terms of the bigger picture and the financial deficit, what can be lost is some of the really high quality service improvement and quality improvement work that is going on and is providing efficiencies. So I think it's all of our staff, or many of our staff, are engaged in that. So I think it's really important to recognise that, and that continues. And also just to say that not all efficiencies, in fact, many efficiencies don't reduce harm or produce harm. In fact, some efficiencies can actually improve safety and quality experience as well. And that is really our ultimate goal. So there's a whole host. We know there are some really important, what we call big ticket items that we need to work really, really hard on. But at the same time, there are really important quality improvement initiatives that will be providing efficiency as well. Sorry, safety and quality as well, sorry.
Thank you, Kate. So Jen, Mick and or Simon, is there anything you want to comment on further or respond to?
Nothing from me. Thank you, Chair.
I just like to, I thought, Kate, your point about that sometimes often these efficiencies actually drive improved quality. I think that's a very, very good point that you make there. So thank you for making that point and reminding us of that. It's a good one. Thank you.
Hayley, do you have any final observations you want to make before we turn to the recommendations for this agenda item?
Yes, thank you. Sorry, I've had a bit of technical difficulty over the last 10 minutes or so. So yes, please. Really helpful conversation and discussion. And I think in particular, the point around the impact of any savings on operational sort of capacity, etc., was a really welcome one, because I think that from my perspective, where we have assessed impact, if that becomes greater than anticipated, we will be reporting that really transparently through to the relevant committee and the board, so that no one is surprised by any emerging risks. And I think the context of this conversation, particularly around the financial position we're facing, is that is this balance, because not delivering savings is not really a neutral option, because taking that planned control action now minimises the risk of us needing to take unplanned, more reactive decisions later, which would indeed carry far greater operational risk. So from my perspective, the controlled approach that we've taken to savings, including the identification of impact, is about making that visible so that we can manage it proactively. So thank you.
Thanks. Pete, are you going to go on and deal with month 1 of 26-27 separately?
Yes, if that's okay,
Okay.
to carry.
Yeah, no, that's fine, Pete. But just before you do that, let's deal then with the recommendation in relation to the month 12 of 25-26 report, and that's that we receive the financial report. We take assurance that the organisation has effective financial monitoring and reporting mechanisms in place. And we are asked to consider the pre-audit financial performance for 25-26 of 33.3 million and the underlying deficit of 45.1 million. I'll pause should anyone want to indicate they want to not support that recommendation or make a comment about it. No, so that is supported. Let's go then to the month 1 report for 26-27. Thanks, Pete.
Yeah, thank you, Carl. So the month 1 report is a summary position. As we get into the new financial year, it takes a bit more time to add the detail to the pack. That's why it's just a summary at this point. So just recognising that our 26-27 plan is unsupported at this stage, but that the board approved our deficit plan of 44.7 million in March. Noting that our budgets have been allocated to service areas as per the board approval of the plan, but noting that we will be monitoring our financial performance against that plan. Included in the plan is the savings target of 22.9 million. And also going forward, we would be reporting our position against our deficit plan, but also against our break-even position, which means that we'll be fully reporting against our underlying deficit in those key areas that I referenced in this part of the month 12 reporting. So that means we will be refining that and including that in our future financial reports. So as of month 1, we do have significant slippage against our savings delivery. and that has resulted us being off profile against plan at month 1 by 1.7 million. That is the position as of April. What I can update the board on, and this builds on the comments that Hayley made earlier in relation to the Financial Recovery Board, is that our latest savings forecast is that we're at circa 70% of our savings target in terms of delivery. So that forecast is that we're now at circa 16 million against our 22.9 million savings target. That forecast means that there's plans and actions in place, and we need to ensure that ongoing focus around delivery of those plans to deliver against the savings target, to close the gap, and how that underpins our overall financial plan and performance. So I won't add further to the Financial Recovery Board comments, but that board is helping us to strengthen our attention and focus on delivery of our savings, both in year and on a future year basis, because those savings areas will look at our total pipeline of opportunities, which underpins our route map to sustainability. And clearly, the more that can be delivered against those opportunities in year helps to improve our financial position, and then understanding that deliverability over future years builds into our route map and delivery. So in summary, the month 1 position is an area of great concern because we're off profile against that unsupported deficit plan at month 1, but do note that expected improvement in our savings delivery as referenced. So I'll pause there and again take any questions. Thank you, Carl.
Thanks. Steve, please come in.
Yeah, thanks, Pete. And as you've obviously just said, it is a concern to be 1.7 million against above our forecast deficit position at this point in the year. I appreciate it's early in the year, but if you extrapolate that 1.7, just did a straight line extrapolation, you'd be getting to a potential risk of possibly up to about 20 million above our planned position, which is obviously significant concern. It's good to hear the progress has happened recently in terms of savings. So first question really is, are all the 60 million savings you just referenced recurrent, or some of them still non-recurrent? And then in terms of that sort of gap between what the potential extrapolation could be and the savings gap, presumably there are other issues in terms of operational cost pressures that might be feeding into this position. So are they also being considered by the Finance Recovery Board? Thank you.
Yeah, thank you, Steve. So you're right to raise the recurrent, non-recurrent factor. It was an issue that, as I reported earlier, around the year-end position for last year. That is an area of focus and will be enhanced. In terms of the Financial Recovery Board, our first stage of focuses have been around ensuring that our savings delivery is met in terms of the target for this year. The other areas of operational potential pressure, I think, given month 1, given some of those areas of uncertainty and issues, we need to be very focused on that as we move into month 2 reporting and make sure that there's further remedial action taken in those areas where needed. So more detail, more information to be provided as we report future months.
Steve, would you like to respond? Or are you content?
Yeah. No, I mean, it's helpful, thank you. But I suppose just to make the obvious point that the more you get into the year, and it will have a bigger impact at the year end if we don't get on top of our savings and delivery now. So thank you.
Yeah, totally agree.
Thank you. Jen, please.
Thank you. I'd just like to ask a point of clarification, if I may, Pete, and I think it was something that Hayley referred to. I hear what you're saying about our savings at the end of savings target at being off target at the end of month 1, but that there are strong indicators that we can recover that position to a significant degree. Is that as a result of the savings sprint work that I think Hayley referred to in one of her reports? Is that sprint work, or working to accelerate and make sure that we can try and get back on track for our savings programme. Thank you.
Yeah, so the Saving Spring workshop was another component of those further actions being taken to ensure we deliver against our savings targets. So it's part of the wider actions that already were being taken, but it's helped enhance that. And yes, the aim is that we get to 100% savings target by the end of June. That's the target we've set ourselves, or sooner. So yes.
Thank you. There are no other contributions. Therefore, we go to the recommendation in relation to the month 1 report for 26-27, which is that we receive the financial report. We take assurance that the organisation has effective financial monitoring and reporting mechanisms in place, and we are asked to consider the financial forecast and the underlying deficit for 26-27 of £44.652 million. Once again, colleagues, please indicate if you don't support the recommendation or want to speak to it. That therefore is also supported and approved unanimously. Thank you all so much. We are running behind time somewhat. However, I have been a little bit more relaxed today in the meeting because of the nature of the reports and so on, and on our agenda. But I do want to catch up a bit of time. So rather than take a 15-minute break, could we take a 10-minute break, please? Perhaps be back at 11:45, please. See you then. Thank you. Well, croeso nôl. Welcome back. We are having one or two technical difficulties and a couple of things. Can I just check that our Chief Executive, Hayley, is able to participate? I know, Hayley, you were having some problems earlier.
Yeah, it's fine.
Things been resolved?
I logged off during the break and was able to come back in, and I've got full functionality currently.
Okay.
Won't touch anything.
Thank you. And the Executive Director for Planning, Performance, Commissioning, Nicola, who was due to lead on the next couple of agenda items. I thought she was also having technical difficulties. Nicola, are you with us? I was going to suggest that we jump over your items and then come back to them. But if you are with us and want to stick with the order as it is, then we can do that.
Yeah, I haven't got any technical issues, if you can hear me.
Oh, okay. Forgive me. I thought that was happening. Okay, well, let's go then to item 3.2 on our agenda, and the Integrated Quality and Performance Report for month 12, the end of year report. Nicola, we're in your hands.
Thank you. So this is the end of year month 12 IQPR, Integrated Quality and Performance Report. I just want to say a huge thank you to all our teams and all our staff for the performance position that is represented in this report. An enormous amount of work goes into providing services that meet these metrics for our population. We have also been asked by Welsh Government to report on a set of workforce indicators which will be appended to this report going forward. And I'll hand to Deb at the end of my introduction just to pick up any points of interest from those as well. But in terms of the main report, we meet the targets for our minor injuries units. We continue to have no patients waiting over 104 weeks in our provider provision. And similarly, we continue to have no patients waiting over 14 weeks for therapies at the end of the year. A similar good position for adult and paediatric audiology against the standards, and for children and young people's mental health measures. And for all of those measures, that has been a consistent position throughout the year, so not to be underestimated. I'm very happy to be able to report as well that at the end of March, we had no patients waiting over 104 weeks for children and young people's neurodevelopmental services. That was in line with the board ambition that was set as part of our annual plan, and the Cabinet Secretary priority expectations for us as a health board. And we continue to make improvements in that service to reduce that waiting time over time. We did have one breach of the waiting time standard of 8 weeks for diagnostics at the end of the year, which is a considerable improvement from where we were at the beginning of the year and progress over a number of years. With no patients waiting over 8 weeks for an echocardiogram or a non-obstetric ultrasound, but just that one breach in the endoscopy service. And our trajectory for next year is 0 breaches for the whole year. So that service has stabilised quite considerably during this time. Unfortunately, we did have 6 breaches right at the end of the year in March for new outpatients waiting over 52 weeks. Which was caused by fragility in an in-reach service around rheumatology, where we had plans in place with Wye Valley NHS Trust, but due to capacity issues, unfortunately, those patients not able to be seen. And that continues to be an issue that we're addressing with the Trust and potentially looking to recommission that service. In terms of adult mental health, similar position to the whole year. So we meet all of the measures for the mental health measures for adults, other than care and treatment planning, where the small nature of our services meet this really difficult for us to meet the measures as reported. We have been reporting the last couple of reports, an issue around the reporting of national reportable incidents, and that not in terms of our reporting as such, but the match between our report and the national reports. And as you can see in this report, that was resolved in May, and the final position, as in May, is reported in this report. So that's the summary for our provider services, and like I say, thanks to all our teams for that good performance against many of the metrics for our population in our own provider services. However, as we know, we are not a provider of acute or specialised care, and so the report also discusses commissioned services performance. As we've reported again, particularly over the last quarter, the improvement in this report is evidenced in waiting times across Wales, as expected in terms of the deployment of considerable funding by the previous government. And the end of year position is that there were 28 Powys patients waiting over 52 weeks in commission providers in Wales, and 10 waiting over 104 weeks, with a number of health wards being completely compliant for those two metrics for our population. There is a lag in reporting in NHSE performance, and therefore month 11 performance is reported in this report and will be updated in future reports. And the effects of our commission intentions to commission to 104 weeks can be seen in both Robert Jones and Wye Valley, with that growth in over 52-week waiters. As you know, and the end of year position remains the same. Shrewsbury and Telford NHS Trust didn't implement our commission intentions, and we remain in dispute with them over that position. Cause for concern, which again we've reported over the last few months, is the number of over 104-week waiters in Robert Jones and Agnes Hunt, with the end of year position being 116 waiters against the LTA position of 63 planned over 104-week waiters. So a deterioration in the expected position in that provider. We have enhanced our performance management arrangements with them, and as reported to the Finance and Performance Committee, there is evidence of some improvement in April, which will come through future reports. And we did do a more detailed position statement for FPC, which I'm sure independent members will want to reference. We continue to experience variability in cancer and accident and emergency waiting times in our commission providers, and the position in ambulance services waiting times is outlined in this report, which was referenced earlier in relation to the Chief Executive's report. So a slightly fuller introduction to this report from me, as it is the end of year position, Chair, but that's the end of my introduction. Thank you.
Much appreciated, Nick. Thank you. We have one or two colleagues wanting to contribute. However, I will invite initially Ronnie, the chair of our Finance and Performance Committee, once again to come in with any additional assurances that you want to offer. I know, Ronnie, it wasn't this report that you considered in your committee, but the month 11 report, but whether there was anything that you wanted to share at this juncture. Thank you.
Thank you, Carl. First of all, my thanks to Nicola and her team for all the work that has gone on in putting this together. We did have an extensive examination of the position at our recent meeting, and are largely assured, but we remain concerned about issues such as Robert Jones and Agnes Hunt, which Nicola has referenced. TNO seems to be a service that is stretched in other locations that I look, but the position at Robert Jones and Agnes Hunt seems a particularly challenging one. So we will continue to watch that and the progress that is made. And I think at that point, I will pause. Thank you.
Thank you, Ronnie. Elaine, our Executive Director for Community, Primary and Mental Health. So before I go to others for questions, Elaine, do you have any additional comments you want to make?
Yeah, I just wanted to thank Nick for the report and also reiterate the point that she made earlier. We see in these reports some numbers, we see some performance outcomes, but I wanted to thank the teams that actually sit behind this. There's been a phenomenal amount of work undertaken this year across all of our services. We see and we report performance on some of those, but actually the really positive outcome we've achieved at month 12 is as a consequence of that consistency, that hard work and that improvement that they've undertaken. So I just wanted to signal that, please. Thank you.
Very important, and echoed by all of us, I think, Elaine. So let me go to a couple of, we have a few colleagues wanting to contribute, so let's take at least a couple. We'll go to Robert and then Steve, please.
Thank you. Long waits for planned care provided by NHS Wales have fallen compared to the performance of a few years ago, and this against a background of increasing demand, and that's movement in the right direction. Is this improvement going to be sustained next year, do we think? And is there any sign that the increase in total demand is levelling off? And if I may add then the third question, which is about the transfer of rheumatology patients to Wye Valley. May similar actions in other specialisms come from the GIRFT review? And if so, when will this review be concluded? Thank you.
Thank you. Steve, please come in.
Yeah, thanks, Nick. I just want to turn to the enabling actions on page 9 of your report and note that the theatre utilisation action is below the 85% GIRF standard. So I don't think there is a figure of what our current utilisation is. So do you have that? And also, I suppose, following on from what Robert just said, what's our sort of timeline to try and address those following receipt of the GIRF report? Thank you.
We'll come back to you, Nick, please.
Thank you. In terms of the sustainability of NHS Wales waiting times, that considerable improvement in year in 25-26 was in part due to non-recurrent investment by the Welsh Government in addressing those waiting times up until the end of March. There is, as actually Steve has referenced, particularly through the enabling actions and other drivers through the planning framework, a considerable emphasis on improving efficiency and productivity in NHS Wales to underpin a more sustainable position. But we do know that our provider health boards are saying that without further non-recurrent monies in this year, it will be really difficult to sustain that position. The majority of them are saying that. So I think we are awaiting whether there will be any announcements from the incoming government. In terms of GIRFT, the report is being finalised as we speak. It does show a lot of opportunities for us to maximise the use of our provider facilities, both outpatients and theatres. And we may want to, I'm sure we'll be considering that together through either a board development session or through FPC in the fullness of time. It is a considerable programme of work to coordinate that between our provider and our commissioned services, but that is one of the programmes that has been driven through Better Together, and also our operational teams to take that forward. So that implementation plan is being shaped as we speak. And yes, we asked GIRF to review our top 10 areas of specialty, areas of spend and activity. So we will be taking actions across all of those top 10 areas, including building on the work that we've already undertaken in orthopaedics to stabilise those services, but also to maximise our local provision. And again, noting that that is very much in line with what our population want, looking at the SLICE report, which we discussed earlier, and maximising our local provision, particularly for outpatients, does a lot to reduce those travel times, which always comes up top of what our population often say to us. In terms of theatre utilisation, Steve, I haven't revised that for this meeting, and I probably need to hand to Elaine so she has a figure on hand. It is something that we will be reporting to Welsh Government in our escalation board and scrutiny meeting next week, so can provide that behind the scenes if Elaine doesn't have that to hand right now. Thank you.
Thanks. Nick, do you, sorry, Elaine, do you have it? Or
I don't have the exact figure. I know that it is relatively low. So last figure was at about 45%, I believe. I would recognise as well that we don't staff to 100%. We staff to the level we have open, but there does and is plenty of capacity for us to be able to utilise differently there.
Thank you. Hayley, I wonder, would you want to comment additionally around the NHS Wales position as regards the elective waiting times?
Yes, thank you, Chair. Just a couple of points. Obviously, the points that Nick raised around the ongoing dialogue that we are all in with Welsh Government across NHS Wales around the current plans and the approach that we've taken. As I mentioned earlier, we've got an ongoing discussion with Welsh Government regarding our plan, as have a number of other health boards across Wales. And in relation to the expectations of the new government, clearly yesterday the FM set out his 6 priorities for government, and on that, cutting waiting lists is very high on that list, alongside building a health and care service fit for the future. So I know that there is a discussion at the moment around the 100-day plan, and in particular just draw attention to the commitment around 10 surgical hubs and undertaking a feasibility assessment around a regional diagnostic centre for cancer in Powys that we'll be needing to work closely together to respond to over the next few weeks. So I think it's a very active conversation at the moment around the position around the current performance trajectory set around planned care, and I would anticipate that that will be in an ongoing discussion over the next few weeks and months, and as a commissioner then we'll be able to reassess and give further assurance to the board on the probability of further improvement around elective care once those discussions are completed. Thanks.
Robert, Steve, do you have anything you want to respond to? No? Okay. In which case, let's take contributions from Mick, Jen and Ian, please.
Thanks, Chair. Nick, I think you broadly answered my question and your response to Robert's. I was just kind of struck by, that there's some significant performance improvements there, some strong delivery, but there was this theme running through them about additional capacity or short-term members. So short-term measures. So the question I was kind of left with is what's the balance between those two things? Quite clearly there's some money's gone in. That's made a difference. But have we actually delivered sustainable improvements that will carry forward? How much of a hit should we expect if that short-term capacity is removed? Is, I guess, the question I was asking.
You, Jen?
My question is similar, but a little bit more specific. First of all, I want to comment and to thank, as you said, Elaine and Nicola, the teams behind all this work, because there is some really positive data and positive comments in this report. The term significant progress is used quite often. We're able to continue.
We're having some connection
within our own in-house.
Sorry, Jen, we're having some connection difficulties. Your mic is in and out. I'll tell you what. Perhaps you might try rejoining. Yeah, and let's go to Ian. We'll come back to you.
Yeah, thanks, Chair. Ian Thomas, independent member. My comments and questions are also related to, I think, what Jen was about to say and what Mick has already said. I think Elaine has answered it in part. I agree with Jen that we are seeing some very positive things in this report, and the report always strikes me as being immaculately detailed, and this time is no exception. Given the overall circumstances we find ourselves in as a health board, though, and given that we are delivering, quite highly in a lot of these areas, although there are some issues, I just wondered what the overall effect is on staff in terms of morale, how we are checking in with our teams to make sure that, as Mika said, we can sustain progress in this area and that we are equipping our teams in the right way in order to do that. So it's really checking in on where we are with the staff. Thank you.
Nick, back to you, or indeed any colleagues that you want to bring in.
Thank you, Chair. So in answer to Mick's question about the balance between short-term funding position and sustainability, is to note that as a provider, we had a very small amount of that funding deployed to us because our position was pretty good on the main metrics anyway. So the trajectories that we've put forward in terms of maintaining particularly the waiting times positions, children and young people's neurodevelopmental services, those really key metrics for us are not dependent on short-term funding. That's based on all the transformation and sustainability work that the operational teams across our directorates have undertaken this year. Obviously, if there was additional monies, we'd use that well, and we've tested our ability to do that with the amount that we did have this year, but our trajectories are not dependent on that. I want to give assurance to the board on that. It's our commissioned services, particularly in Wales, their trajectories and feedback to us that's dependent more in that, or has been dependent more in that space. But I think Hayley covered that in the reply, that the further contribution that she just gave in terms of Welsh Government expectations. I will hand to Elaine to talk about staff and morale, but Paul may also want to contribute, noting that children and young people's neurodevelopmental services sit in his directorate as well. Thank you.
Thank you, and thank you for the question actually about the staff, Ian. I think it's really important to note that we have some really dedicated workforce who are committed to that approach of continuous improvement and identifying the barriers that are faced when we're trying to deliver more rapidly for our population, as well as a higher quality for our population. So our staff are actively involved in this and engaged. They own these target measures that we have been set, but they also are very good at looking at the measures they want to set for themselves and pushing themselves further. So there's also the issue around sustainability of this. And I think notwithstanding the challenges we've got around savings, that sustainability at the moment is not compromised. What does tend to compromise us from the planned care perspective is some of our in-reach capacity, and we've spoken about that previously, and that continues to be a challenge that we are grasping. What challenges us with some of our diagnostic and therapies in particular is some of the very smallness and distribution of our teams, which I think is always going to be a challenge for us. But I'm very confident in the real commitment and the high moral sort of and ethical values our teams have for delivering for our population in that way.
Paul, would you like to add anything?
I've nothing specific to add, but would go back to Mick and Ian in terms of the ND and a specific around that.
Yeah, okay, thank you. Ian, Jen has indicated that that her comment or question has been dealt with, so doesn't need to come in. But Ian, Mick, you can take. Would you like to offer further comment?
No, I'm content, thanks. You know, the collective responses, you know, are reassuring. Thank you.
Yeah, me too. Thanks, Jack. Thanks, Steve. Thank you.
Okay, thank you very much. In which case, we turn to the recommendation on this item, which is that we discuss the content of the report. We have done that, and we take assurance that the Health Board has appropriate systems in place to monitor performance and to respond to relevant issues. Once again, I will give everyone an opportunity to comment on the recommendation or dissent from supporting it, should anyone wish to. That too is supported unanimously. We're sticking with Nicola as we consider under item 3.3 the annual delivery plan report, the Q4 report for 25-26. Thanks, Nick.
Thank you. In a similar vein to the last report, this is our end of year report for the delivery of the annual plan 25-26, and shows that there has been good progress in delivering the annual plan that the board approved for submission to Welsh Government for last year. The report outlines that our planning responds to our strategy, which includes our wellbeing objectives, which demonstrates how we respond to the Wellbeing of Future Generations Act requirements and our longer term planning. And there is a section in the report on that, because this end of year report also provides much of the material on the performance side for our annual report. So when the board and committees see our annual report, it is informed by this position, as well as the performance report that we just discussed. At the end of the year, there were a number of actions that weren't delivered. It's around 9% of the total actions, and that is in line with previous years, and those are for a number of reasons. In some cases due to fragility in teams, in others to those actions being outside our control, in others in terms of changing priorities through the year, and particularly in relation to our recovery status. And the reasons for those are outlined in the paper. That is an area, as well as our good progress, we always reflect on that in terms of our planning process and our planning assumptions, and we'll continue to do that in our planning rounds for future years. However, similarly to the Integrated Quality and Performance Report, I do need to acknowledge again the hard work of all our staff in delivering our plan. It is very extensive, and it responds not only to our strategy but to national policy and our main risks and our recovery requirements. So we are a complex organisation providing very important public services, and as a result our plan is also extensive and complex. So hundreds of actions represented in our plans across all of those parameters, and from page 147 onwards, a significant list of achievements and progress that we demonstrated throughout the year, which again will be represented in the annual report and again formed part of the basis for our planning to build on in 26-27. So, Chair, I'm not going to introduce the report any further than that, and I will pass back to yourself. Thank you.
Thank you. Again, it isn't unusual for us to include the quarterly reports within the consent agenda. However, this is an end of year report, and quite rightly needs to be on our substantial agenda should there be any questions or areas of discussion that anyone wants to pursue. So colleagues, please do indicate if you have any questions or comments in response to the annual delivery report. And I'll go initially to Mick, please.
Thanks, Chair. Nick, as ever, this is a very impressive and, really well presented report. And, it can, if you just step back, the amount of effort and energy which goes into delivering and monitoring and tracking all this is really impressive. So I just start with that position. And, it's really clear there's been quite a significant volume of activity delivered over the year, but, it's honest and credible in terms of what hasn't been done and where those risks lie. I was really pleased to see in section 7 that kind of schedule of outcomes under the key strategic objectives, and good to see that you've responded to that feedback from previous years about strengthening the report. But I just would welcome a sense of where it kind of goes next, because that's a collection of kind of outputs and metrics and kind of narrative about what we've delivered. It just seems we're in a position now where we could start to think going forward about how this could become an evidence-based impact report, which would add considerably to our kind of governance arrangements. So I just wondered whether that was part of your thinking, that this could become a much more kind of structured, outcome-focused, evidence-based assessment of impact, rather than a kind of a presentation of a volume of activity and some developments have taken place as a result. Does that make sense?
Please do come back. Yeah, thanks, Nick.
Yeah, thank you. And Mick, a mirror that you always hold up to us in our planning as well as in the monitoring of our plans. So I think in our annual plan for 26-27, we have linked the actions more to, for example, the enabling actions, the performance measures, the things that we monitor more through the IQPR, and we'll be able to build on that in our monitoring then, because the two things are inextricably linked. We need to lay out what those outcomes we're attempting to achieve in the plan, and then monitor through in those reports. So I would say we've taken a step forward again, but I think we're working for us. Thank you.
Yeah, thanks. And recognising in different places I've been involved in similar conversations, it's hugely difficult to demonstrate evidence-based impact, but I think it's a goal worth striving for.
Thank you. So let's bring in Simon and then Jen.
Many thanks, Chair. Nick, I'm just looking at page 14 out of 28 over to 15, 28, SP11 and the pathway development redesign, particularly around commissioning cycle, and a lot of that is on low confidence delivery, waiting for other things to happen. I'm just interested to know how these actions might be recovered in the coming year, given the priority we do have around dealing with commission services. Thank you.
Yeah, I think I would note quite honestly that this SP11 got away from us in the change control that we undertake through the monitoring of the plan. I think once we had agreed that we were commissioning the GIRFT review, and that would inform our priorities as well as our actions to take forward that pathway redesign and repatriation. At that point, really, we should have done a piece of change control to say that these actions were not going to be completed in a year, and actually we needed to wait for that report to inform our plans for 26-27. And our plan for 26-27 clearly says that we will be taking forward the early priorities of the GIRFT review, which, as we've mentioned in the previous report, we now have with us, looking for those early opportunities in the latter half of 26-27, and then really motoring on that in future years, because it's probably at least a 3-year programme of work to take that forward across those 10 pathway areas. So yeah, being honest really about that. Okay. And actually what happens is our plan changed throughout the year, and then we didn't do that change control in the way we normally would.
Okay, thank you.
And Jen?
Thank you. Can you hear me okay, Chair?
Yes, we can. Thanks,
okay?
Jen.
Okay, yeah. Right. Apologies for my connection before. Nick, as ever, really good to celebrate much that's in this report and congratulate, which should not go unsaid, and others have said that, so I just want to endorse that. And also for the candid nature that you've said in this report, which is there's still work to do in many areas, so thank you. I note at the very end that this report then goes to Welsh Government, and I'm just interested to know, I know we're in dialogue with Welsh Government a lot over our escalation criteria and our financial planning, etc., and we get feedback from Welsh Government about how we need to be better and what we're doing in that space, etc. Do we also get feedback on the positive data that this report contains in terms of our performance? I'm just interested to know that it would be good to get some positive endorsement of our work from Welsh Government and what opportunities there are for Welsh Government to do that for us, if indeed they do. Thank you.
Thank you, Jen. I think these reports that are provided by all health boards on a quarterly basis form part of the assurance overall on Welsh Government as they're reviewing particularly our escalation status, but also as they're preparing and thinking about the assurance and scrutiny questions they want to ask us through the new performance and accountability arrangements. So I wouldn't say we get direct feedback on them, but I think the tone of the conversations they have with us are underpinned by the fact they do take assurance from these reports and can see in a large part the good progress we're making on the delivery of our plans. The fact that the process for producing these reports also received substantial assurance from audit, also adds that assurance both I think for ourselves as a board but for Welsh Government. So we do discuss that informally with the Director of Planning, for example, through our escalation touch points, but I think it does mean that it informs part of the tone and that assurance that they have in those wider arrangements, I would say. And I can see Hayley wants to come in. Thank you.
Thank
Hayley,
you.
please do.
Thank you, Chair. Jen, I think it's a really important question, and Nicola's really comprehensively answered it, because I think it does make a difference in terms of the tone and the content. However, we're in escalation for particular matters, so inevitably in our interface conversations with Welsh Government, we focus on the areas where we've got to improve and we've got further to go at. But I think it's an important reflection because, building on Ian's contribution earlier around morale, we've got to find a way of getting the right balance around the narrative with our staff and with our public and stakeholders around the things that we are doing well and areas we do need to celebrate. And if I'm frank, as an organisation, as an exec team, we've reflected we're probably not as good at that as we should be or could be in terms of highlighting the progress and things that are going well. So I think that's something for us as a board to think about. How do we get that balance between celebrating what's gone well and the progress and then obviously continuously focusing on the areas we need to do better at. I think Mick's point around the evidence base, and in particular how do we get that impact articulated clearly is a challenge for us, and I think it's a really important challenge, and we need to think about how we can do that, because I would say there are pockets where we do that really well, but we might need to recognise that's going to take us some time to mature overall, and perhaps use a few examples going into this year's annual report where we know we've been able to do that really well. But my final point I wanted to raise, Chair, is that the point earlier about what it's taken to deliver this level of delivery in our annual plan from every member of staff, and the commitment, including of the executive team, from our whole team, and the resilience and professionalism they've had to deliver this year has been exceptional. It's not been easy, it's been tough, it's been a tough environment, and the ask is growing year on year. We've talked about it in a couple of